Okay, I'm doing the other side, and I'm going to, well, I guess you just, it doesn't really matter. You know, you don't have to follow a certain method. You can do your own method. This is just a recommendation. So I'm started like by my middle chin, and I'm working up, stamping that way, okay? Go up and down, and then just keep going. And I've decided that I'm going to do my under my eye last. So I'm doing, this is horizontally. You can tell I have a full face, like chubby cheeks. So if you have that situation like I do, you can see how I puffed it out like a puff fish. That's what we'll call myself right now, a puff fish. And just go all horizontally, okay, all the way to like your nose area, or nasal area, with this. And I think I probably should slow down, but it's kind of I'm kind of anxious a little bit, I think, too, because I'm new. But then I'm going to go vertically stamping all the way back down to the right side, to that chin bone, and just work your way down, up, like this, and go all the way up to your cheekbone. Puffer fish. I can definitely tell you that when you puff it out, if you have full cheeks like I do, or a full fat face, you can feel it better. You can feel it penetrating your skin better. Now I do feel like I want to go in a circular motion after I do the stamping. Gosh, I turn this. Dr. Penn, if you're watching, redo your handheld device with, I love the device, but the hand, you keep, if your hand barely touches it, it turns it off. So you have to turn it back on. It's not that big of a deal, but I don't know, little things like that annoy me. Okay, so I feel like after you do the vertical, and you do horizontal first and then the vertical, I feel like kind of rubbing it across your skin isn't so bad, but I still like the stamping area. I still like to stamp it. Now I can see that I will definitely go up to a 0.5 on my cheeks, but I don't know about all these ones and higher levels. That's just gonna take a while to do. But hopefully I'll get there. That'll be the goal. It can be everyone's goal. So it's not so bad doing it this way. If you're like up and down in a circular motion or anything like that, it's not too bad, okay? So you can, the more you're doing it, the better you feel about it, and your confidence gets better, because I was really nervous at first, I can admit. Now this area around my mouth is the part I hate the most, besides my neck. Ah. Without having surgery, we can do preventative things like this. I don't feel confident in having any kind of facial surgery or neck surgery. Maybe in my 60s, I don't know. But, so around your lips and your chin area is where it's more sensitive, I do believe. So I'm gonna really take it slow. And you don't want to touch your lip, because that is a very sensitive area, but you want to go, and you want to bend your lip down like you're going, oh no. Oh yeah, the lip, super sensitive. But those are where as you get older, your skin is really thin. Well, our skin's thin there no matter what, but as you get older, you can really tell the fine lines and wrinkles in that area. Oh my goodness, yeah, I don't know how anyone goes to 0.5 on the lip area. I really don't. So I'm gonna just do the stamping above my lip, maybe some small circular motion, real slow. Okay. You kind of get, it feels like a little pinch is all it feels like when you're doing it this way. The stamping, you're stamping the needles into your skin, obviously. But it's important to get to areas that bother you the most, and this whole area bothers me the most. All right, so now, like I said, keep on doing the hyaluronic acid every time you're using it. Ugh, got some in my mouth that did not taste good. So I'm going to do my whole chin. Let's do vertically first. I mean horizontally. Gosh, I always have my whole entire life gotten those two mixed up. You know, the way I learned it was H, and the H in the middle, that's how you know it's horizontally. Maybe you learned it that way too. But I'll be darned if I'm not talking to someone and I'll have to stop and put an H so I know it's horizontal and not vertical, because I constantly mess that up for some reason. It's a crazy little thing. So the chin is not bad at all. Not bad at all. None. It's like, I can see I can go up to a 0.5 on the chin. Take it on the chin, as they say. The neck, I might have to do my neck tomorrow or another day, because it's going to be a lot of redness. But I also feel like if you don't tackle what you want to tackle from the get-go, or from the jump, as they like to say. See, I'm still saying young people's verbiage. I don't want to be old, but guess what? I'm going to fight it, and you're here to fight it with me. See? Gosh, I turned it off again. That's like 4 times now. Okay. Let me put some more of my little transference hyaluronic acid. Oh my goodness. And I also actually turned it up to level 4 and have no idea how that happened. So the more you touch this little button right here, the higher the level goes. I don't like that feature. I have to be honest. So, and also this thing is cordless. I just now plugged it in because it's been sitting in the box. Guys, this thing has been sitting in my closet for months, like probably 7 or 8 months, and I was just so terrified of this thing. I did not want to tackle it, but as I am blowing out my candles yesterday on my cake, I thought to myself, tomorrow is the day I'm going to get on the treadmill. I'm going to really start taking care of my skin more, even though I feel like I've always taken pretty good care of my skin, but sometimes you just can't fight aging. All right, I've probably gone over this area more than I should, but I want to, and you guess what? You can, because I'm only at 0.25, so again, like, you might want to stretch the skin out like that to get in those crevices. As we age, we get those little crevices in our face. Ugh. All right. Then I'm going to go in a circular motion. And like I said, I have other transference things that were recommended to me, but we'll talk about that another time. I'm going to use those the next time. So far, I know it's my first time. I really like this hyaluronic acid, though. No wonder it's one of the top sellers. And I am not getting paid for this, just so you know. Alright, so now I have to go under my eye. Don't really like this part, but you need to pull your skin away. You want to wash with the alcohol, and then, actually I am severely right-handed, so severely, like I can't use my left hand hardly for anything. And so you just want to get as close as you can you want your eyelid to come down, but you don't want to get into that bone, because that will be very painful. You can kind of just go in any motion you want, actually, right there. And then you want to take some more of this hyaluronic acid and get your crow's feet. Crow's feet aren't too bad. If you could pick and choose, which would you choose though? Do you want your mouth and neck to be saggy, or do you want to have crow's feet that can be controlled by Botox if you need it? I think I would rather have crow's feet, but it's only because I don't like my mouth and neck area. I actually hate it. Alright, so gotten those. Again, when I get close to my hairline at all, it feels so strange. It's like a shocking vibration, but without the shock, if that makes any sense. Probably not, but that's how I'm going to describe it for now. I don't know what that's called, but let me go to this other side. Get those crow's feet. It's weird because my left side, so weird actually. I have a lot of things going on with my left side. But I seem more sensitive on my left side with the crow's feet. I am more sensitive actually. So I don't know what that's about, but I can definitely feel the pinching and the needles a lot more on the left side than I could the right. It's so strange, even it did that on my forehead. Now, I'm gonna try the nose. I don't know if I'm gonna be able to tolerate the nose. I don't feel like the nose has, I don't know. I guess we shouldn't be impartial to the nose. We should try it in all parts of your body. If I don't like it, I'm not doing it again, just so you know. Okay? Are we in agreement? And look, I turned on the red light therapy on accident, so maybe that was a sign. Maybe the red light therapy needs to be there for penetration and to help heal quickly. It's not too bad on the nose, actually. Not bad at all. I don't even hardly feel it. I'm really numb in my nasal area. Yeah, not bad at all. So if you can, do the nose. Don't skip it, because it does not hurt. When you get into that part of your nose, it's a little more painful, but not like I thought. And I think I am going to go ahead and do my neck. Why not? Let's just go all out on the very first day. Why not? And this little headband, I paid like $4 or $5 for it. It's literally a lifesaver. It keeps your hair out of your face, and you don't want to be trying to microneedle your hair. All right, so I'm probably going to do something a lot of people don't do. I am going to, I am a trial and error type person. So I'm going to squeeze some more hyaluronic acid. It comes in this jar and it's a little thick. It's not, I thought it was going to be thinner, but it's not. Again, it's this brand, gosh, I'm blind, Baja brand. And I'm going to take this and I'm going to go all over, because I am only at 0.25. If I was at 0.5, maybe I wouldn't, but I'm going to go over my entire face again. I'm going to rub this. I'm just going to go in the circular pattern all over my entire face. And I may need to apply more because it helps it smoothly transition. And, I am not a professional here. I'm not claiming to be. I am someone who just loves to take care of my skin. And as I've gotten older, you're kind of forced to do so if you want to retain any of your youth whatsoever. Or you like for your skin to feel good and fresh. There's nothing better than getting a facial. I love a facial. Love it. Anytime I go to anywhere that has a spa, I choose a facial over a massage. Any day. Any day. Love a massage too, but if I had the choice, I'm getting a facial. And I want to try anything new that's out there. Some may say it's a gimmick. I don't care. Your skin still feels amazing afterwards. So if you go to any spas, get your face done. Let them pamper you. Enjoy it. So right here, okay, right here in my chin, remember earlier it didn't hurt? It doesn't hurt still. But without the gel, without the hyaluronic gel, it's not going across my skin that smoothly at all. It was actually feeling sticky. I kind of wanted to be bold and turn it up to 0.5, but I'm going to wait. I'm going to wait. I'm going to not be impatient like I usually am with certain things. But I do like the feeling after you do it, the stamping and figuring out your method, taking this and going all over your face with it in the circular motion, because your skin's already penetrated anyway. So I feel like it's kind of massaging the hyaluronic acid into your skin. That's how I feel with just me not, you know, being a non-professional here. Oh yeah, so it dried on my forehead and it's doing that weird thing again. So I'm gonna stop on my forehead. All right, the next video I'm gonna post me doing my neck. Ugh, the neck. I hate the neck, but it's part of our skin, right? We have to do the neck. Okay, see you guys next.